Alright, so my topic was infectious disease, and I'm Brian Johnson. Alright, so the area of infectious disease I chose to focus on was healthcare-associated infections. And the CDC defines this as infections patients get while receiving medical treatment in a healthcare facility. If we just look at some of the prevalences of the healthcare-associated infections, you can see that 1 in 25 hospital patients will have at least one healthcare-associated infection. Also in 2011, there was an estimated 722,000 healthcare-associated infections in U.S. hospitals. Some of these infections include pneumonia, gastrointestinal illness, UTIs, primary bloodstream infections, surgical site infections, and just other infections in general. So the World Health Organization has put in a program for hospitals to follow to limit these infections. So with the Infection Control Committee, this is a wide variety of people, from the management of the hospital to the physicians, pharmacy, maintenance, and even housekeeping are all involved in the prevention of healthcare-associated infections. So their job is to review and approve the program of activity for surveillance and prevention of disease. They must ensure appropriate training for the staff and also communicate with other committees of the hospital. And we'll see that each of these people involved have their own specific role in the prevention of the spread of infectious diseases. So with the hospital management, they're really the one who establishes the Infection Control Committee. They're going to identify resources for the program to monitor infection and delegate those resources. And they're going to also delegate aspects of the hospital hygiene to the staff. So the nursing, housekeeping, maintenance, and even the microbiology lab are all responsible for the hospital hygiene. So for the physician, they're providing the patient care to minimize infection. And of course, they're going to practice appropriate hygiene, washing their hands every time they go in a room, using their Purell. They're also responsible for notifying the cases of the healthcare-associated infections to the team. Also, they will advise patients and visitors on techniques to minimize infections and treat those who have gotten an infection in the hospital. With the role of the microbiologist, they are handling the patient and staff specimens. So they need to develop guidelines for how to collect, transport, and handle these specimens to ensure that there's no diseases being spread. And of course, they're going to ensure proper laboratory safety practice while doing all of this. And then lastly, the role of the housekeeping service is they're going to classify areas based on the need for cleaning, and which areas need more cleaning than others and what cleaning products to use. They also develop the policy for cleaning techniques to ensure that these infectious diseases are being eliminated when they're cleaned. And lastly, they're going to develop a policy for transport and disposal of waste. The last thing I wanted to talk about is the healthcare-associated infections in Oklahoma. And if you can see that generally all of them are going down. So if you look at central line-associated bloodstream infections, they're down 57%. And then you can see all the rest are down somewhat, some more than others. But the only one that is going up would be the MRSA bacteremia. So the laboratory-identified hospital-based bloodstream infections is the only one that's going up in Oklahoma. So clearly, these protocols have worked for us for the most part, and we're seeing a great trend in the lack of the spread of healthcare-associated infections.